in. I'm going to give everybody a chance to come on into the chat and make yourselves comfortable. Hopefully have a tea, glass of wine or something, and are ready for our Tuesday night together. Happy to see you with us if you are a familiar face, and if you're a new face, happy to have you joining us for the first time or for the 50th time, whichever it may be. My name is Marissa, and before I jump on into our chat, tell you a little bit about me, we get into our guests and our topic for tonight. I always start off just wanting to know a little bit about you. So please, in the comments, let me know a little bit about you. If you are a new follower of NJ Mom, and if it's your first time joining us, please let us know. If you are a familiar face, please say hello. Always love to see our mamas back with us week after week. Already see Nicole in the house. Hey, Nicole, good to see you. Yeah, so please let us know a little bit about you, how old your kids are, where you live in New Jersey, and what brought you into the chat tonight, and also just how your week's going. Hopefully going well for you. Tuesday always feels like the longest day to me. I don't know if any of you moms agree, but at least in my house, that it feels that way. So we got through Tuesday, so that's good news there. We always do a couple other things at the beginning of our Tuesday night chats together as well. We started doing these back in the spring when the pandemic started, and we always like to just remember our frontline workers and all of our essential workers who are still just doing so much and dealing with so much. And we always just like to give them a shout out and a moment of appreciation from our NJ Mom team. So if you are one, Nicole, I see you, and you're joining us and you haven't heard it yet this week, thank you for everything that you do, and we appreciate you. For those of you who don't know me, if you are tonight, like I said, my name is Marissa. I have 3 kiddos under 5, and I host our NJ Mom TV. And we love these Tuesday nights in with you guys. It's really just a chance to connect with moms all around New Jersey and talk about issues that are impacting us all together at this time. So thanks for being here. Krista, newly certified postpartum doula and birth and bereavement doula in training, mom of 3 boys in Lawrenceville. Thank you for all that you do. Such important work. As someone who is a baby loss mama myself, bereavement doulas in general are amazing, but that is a very special calling and one that's close to my heart. So happy you're with us tonight. And we're going to get into a lot of discussion tonight that I think you'll find really helpful. So happy that you're here with us. Hey, Emily, good to see you. That beautiful baby of yours is adorable as the other 3. Congratulations again. I'm sure things are crazy in your house. Let us know how it's going. Emily just had her 4th, right, Emily? Good to see you. All right, so I'm going to give everybody a chance to come on in here, and we'll get through a couple other things we want to discuss that I want to tell you guys about before we launch into our discussion tonight. So we're going to be talking about maternal health tonight. Such an important topic. Obviously, as moms, this is a topic that affects us all, has affected us all in some way, shape, or form. And we heard so many interesting ideas and so much interesting feedback when we put up our weekly poll about this. So we're going to get into all of that with our guests in just a few minutes. But before we do that and really dive on into that topic, a couple new things up on NJ Mom this week that I just wanted to let you guys know about. We will be dropping the links to all of these in the chat comments. And if you have a question for our guests tonight, that's where you'll put your questions as well. So if you're new, just joining us tonight, drop your questions in the chat as we go along. Even if we're talking and we're in the midst of something, just drop it there. I will get to it. And we will get to your question and dive into that part of the discussion. So a few articles I want to mention. Our NJ Mompreneur of the Week this week is a really interesting one. I had the chance to interview her and write it, and I loved learning about her. It's Lauren Sinclair, and her business is Buckle Bath. Really ingenious idea. Basically, it is a mobile service that comes to your home, physically to your driveway, and deep cleans your child's car seat. So as moms, we've all had those sort of car seat disaster situations. And so really genius idea. She has a background at Google and kind of took that background and created this really ingenious business. So that is up on our site if you haven't had a chance to check that out. We're also doing a giveaway, a buckle bath giveaway on our social pages. It's on Instagram, and it is 1 year of free deep cleaning for your child's car seat. So amazing giveaway. So check that out. So Nicole wants to know, does buckle bath come up to Sussex County? I'm not sure, but in the article, Nicole, it does mention some of the areas, and they have like a full list on their website. So we'll drop the link to that. Oh, we just dropped the link to the that article here. So check that out. And I think it says all of the areas they go. They are expanding as well, I know, this year. So that's a fantastic giveaway. So definitely enter that if you have a little one and would like to take advantage of some deep cleaning. Also, another weekly favorite up on njmom.com is our kid-friendly things to do this week. This is always a hit. I know I always hear from mamas in the chat each week who go to some of these places and check out some of these events and always have great things to say. So I know you guys all love it. This week, a few really fun ones, just quickly to mention. There is a guided seal walk happening at Sandy Hook where you actually search for seals. So I know we're all looking to get out of the house these days as much as we can with the kids. And so super fun thing to do and kind of immerse ourselves in nature. I thought that was really neat. There's also an antique toy train show happening in Deptford, South Jersey, that I know my boys would absolutely love. And some other fun ones also. And we have that for you in the chat if you want to check that out. Friendly things to do there for you. And then just one other really cool one I wanted to quickly talk about it. And I know so many of us are looking to support local businesses in any way we can, continue to do so right now. And we're all working out a lot at home. So this is a great one for this time of year, especially. We broke down different fitness studios in New Jersey, 11 different fitness studios that are live streaming that you can work out in your living room and also still support a local business by doing so. So check that out. There are some, fan favorites in there, but some new ones that were new to me as well. So that is up as well. Okay, so that is a rundown of what we have going on. As always, we love to see you hashtag and tag us in your pictures and share those with us. We appreciate it so much. So thank you for using the hashtag NJMom. Thanks for tagging us. We use your pictures in features and roundups all the time on the site and online. On Facebook, we have our cover photos of the week. We choose 5 cover photos of the week each week to put up. So all you have to do, if you have one that you think would be great this week, I know we're seeing some Valentine's related ones starting to come in, just comment a picture on the Facebook post that says cover photo of the week, and we would love to see those. So thank you for tagging us in that. Let's see. That is, I think, what we have going on. Don't forget to take our weekly poll also. I just really get so much out of hearing what you guys are thinking and feeling about the topic that we're going to be discussing each week. So we put that up to really get a read on what you guys think and want to hear about and talk about related to the subject. So appreciate those of you who have responded. And when I was reading through tonight, there were some really great comments about the topic of maternal health. So I know it's one that affects so many of us, and there's so much to talk about related to it. So I'm going to bring our guests in here in a minute. Just waiting for Debbie to pop back on. I think I lost her now. So if you can hear me, Debbie, just pop your camera back on. But maybe we will start with Nadia, and then I'll bring Debbie in a minute. Okay. So pop in Nadia. Oh, Debbie. All right, let me see. All right, Debbie says she's here, but I don't have her on air. But Nadia is with us. I'm sure Debbie will pop back up in a minute. I'm just going to mute her for now until I see her picture come back up. Debbie, maybe you can X in and X back out. But Nadia, thank you for being here. Happy to have you with us. I would love for you to tell our moms a little bit about you and what you do with Moms Rising and what your organization is all about.
Well, thank you so much, Marissa, for this amazing platform and for just bringing together so many moms just to connect with one another. As Marissa mentioned, my name is Nadia. I am now a senior campaign director with Moms Rising, which is a national advocacy organization working on multiple issues that impact families and children. So we are an advocacy organization, and we do work on, like I said, we have a multi-issue platform. One of the things I work on is maternal health, mortality, morbidity, and all of the kind of social determinants and health determinants that work around that. My work is also focused on racial justice. There is such a massive disparity that Black women experience when it comes to maternal health outcomes, both experiences and injury and unfortunately death as well. And so that's also a very central part of our work. Moms Rising also works on things like paid sick and family leave, pay equity, things like access to healthcare, immigration, gun safety. We do work on a myriad of things. Is to really galvanize moms, and because moms are powerful and we're a movement, and so that's kind of why we started about 15 years ago. And our maternal justice work has really been focusing on addressing our nation's maternal health crisis. We have the worst maternal death rate of any developed country. Women who give birth today and people who give birth today are more likely to die and suffer serious injury in childbirth than a generation ago, which is really unacceptable. And unfortunately, Black women die 3 to 4 times of white women, regardless of socioeconomic status or area code or education. So that's kind of some of what we do.
I mean, there's so much there. And first of all, it's all such important work. So thank you for dedicating your life to that, because I know as moms, we all have great respect for all that you put into that, because it is so important. I'm going to turn things over to Debbie briefly so she can give a little introduction into herself. I have a crying child upstairs, so I will be right back. I'm going to mute myself. I know you mamas understand. Bear with me, and I'll be right back with Deb. Just tell everybody a little bit about you and about the 2 Degrees.
Hi, everyone. I'm Debbie Hain, Vijayvergiya. Bad camera angle, I apologize. I'm a stillbirth parent advocate. In July 2011, my daughter Autumn was born still. She was my 4th pregnancy in 4 years, and I had seen my fair share of maternal health issues, ranging from I contracted a late presentation of Strep B after the birth of my first daughter. I had suffered 2 miscarriages, and when I found out that I had lost Autumn, I really couldn't understand how someone who'd been pregnant for 4 different times, had birthed 1 child, had no idea what a stillbirth was or that I was even at risk. And so I found myself struggling to make sense of it all and to manage the grief that I was going through, and found myself completely unable to breathe. And I finally realized the only way that I could make any sense of what had happened was to act and speak out and share my story and share Autumn's story. And so I began to write, and I began to speak at conferences, and I found a champion in New Jersey Senate Majority Leader Loretta Weinberg, and we worked together to draft New Jersey's first ever stillbirth legislation, which was named after my daughter, and it's called the Autumn Joy Stillbirth Research and Dignity Act. And I felt strongly about working on this legislation because I had a very hard time in the hospital where I delivered her and the way in which I was treated, and I wanted to help protect other women from suffering the same way in which I had. And so with the Autumn Joy Act, in its most basic form, it is to improve policies and protocols in hospitals when a stillbirth occurs, to improve and create compassion and more dignity for the families who are suffering. And lastly, improve data collection because that is one area that we'll never be able to understand why stillbirths occur unless we have more data and research that we can analyze. And so soon following that, I established the 2 Degrees Foundation. I co-founded it. And the 2 Degrees Foundation is a New Jersey-based nonprofit organization. And our goal is to give every family in New Jersey a fighting chance against stillbirth. We hope to empower expecting mothers. We hope to raise funds for research to create awareness and education and training so that we can truly start to improve stillbirth outcomes. And that is.
Thank you, Debbie. I'm back. Sorry about the interruption. So, you know, first of all, both of you are incredible and have done so much for mothers in your own right. Debbie and I, just for our moms watching, Debbie and I connected after both losing our daughters. My daughter was not born still, but I lost my daughter shortly after childbirth. And so when I heard what Debbie was doing and the work related to that, you know, we connected on that front. And I've seen so much of what 2 Degrees has done since then. And so both of you are amazing. And Nadia, I just learned so much about you through Debbie. And I wanted to talk about this idea of kind of different organizations in New Jersey who really fight for maternal health and maternal empowerment kind of coming together, because Debbie, you guys organized a roundtable related to this. I'm fortunate to be moderating it in a few weeks, but why did you think it was important to kind of get these groups together? I think when people sometimes hear maternal health, they think maybe only maternal mortality. But as we just heard, there's so much really surrounding it, and it's a very layered topic. So just take us through, you know, your thought process on that.
So the idea to put together a maternal health roundtable, really, it was on the heels of all the amazing work that First Lady Tammy Murphy has been doing with the Nurture New Jersey maternal and infant health plan. And at a federal level, Health and Human Services is rolling out a maternal health initiative, which is quite similar to what New Jersey is doing as well, just on a much grander scale. And they're using maternal health, and of course, mothers at, you know, their well-being is at the forefront of maternal health. But there's so many facets to it, and New Jersey is full of so many amazing organizations. And I felt that this was the prime time for us to sit down at the table and talk about, at the core of everything that we all do is maternal empowerment, right? So whether it's Nadia and what they're doing and empowering women to have a voice, moms have a voice and advocate on issues that they believe in, or whether it's definitely the maternal mortality piece. And, you know, there's the Tara Hansen Foundation, there's infant mortality, and we have the amazing SID Center of New Jersey that has done wonderful work. We have maternal mental health, we have 2020 Mom, and we have women, female empowerment with Jay Wilson and Melanated Moms. And at the core of all that we're doing, we want to empower moms to feel confident to express their concerns, not to feel stigmatized or worried that maybe the way that they're feeling is wrong. We want to empower women and moms to live healthy lifestyles, you know, for the well-being of themselves and their babies. And so we felt like, and most importantly also, you know, the mental health piece, there's such a stigma around, you know, feeling that, you know, you're lesser than if you are struggling with that. And so I figured, why not sit down at the table and talk about a way in which maybe we can collaborate and share this message to empower all moms in New Jersey to, you know, feel confident in themselves and the decisions that they're making for themselves and their families.
Yeah. I just want to say quickly, Nicole says, thank you, ladies, for doing this. Honestly, I think more needs to be done about it, research, compassion, etc. Yeah, you know, it's so true. And Nadia, to hear some of the stats you mentioned in the beginning, it stops you in your tracks. And so Nadia, maybe you can take us through some of, I guess, what your organization has been able to do and really what still needs to be done in terms of getting all of us moms up to speed on where things stand. Because if this isn't something we study and do every day, a lot of people aren't aware of the real need for the research, the compassion, the advocacy, all of that.
Absolutely. Awareness and education around maternal health is really, I can't underestimate how important that is to know, for everybody. If this is something you're concerned about, learning more about it, there are great organizations, not just in New Jersey, but who do work nationally, including in New Jersey, that work on this issue. And, with maternal health, I always say maternal health is the outcome. It's not where you start. A healthy person is going to have a healthy birth. Okay, if you already are exposed to environmental toxins, if you don't have access to quality health care, if you don't have healthy foods or access to healthy foods, if you're struggling with health care, if you're struggling with the kids you have already, if you don't have access to reproductive health, to be able to choose when you want, or if you want to have a child, or to do family planning, right? Like, these are all of these factors. Like, do you have transportation to get to healthy foods? What is your economic situation? Do you have health insurance? Are you on Medicaid? And are you in a state where Medicaid wasn't even expanded? So there's such a myriad of issues that then come down to maternal health. We don't get pregnant and we don't give birth in a vacuum. The social factors, the environmental factors around us are what kind of lead us to where we are. And what's interesting is it's not even, it goes beyond that. There's even historical factors. What they found in Black women, for example, is things like generational trauma, epigenetics, right? Where trauma can be embedded in your genome. And this is not science fiction. This is actual research they found about what the impact of historical trauma on health and even on birth outcomes. So yes, maternal health, if someone can look at it on the surface or just see the word maternal health, it can seem like something that, okay, it's just those 9 months. Okay, you got pregnant, those 9 months you gave birth. All right, maybe,
That's it, right.
Later, you have a baby. And I even said, when I'm a mother of 2, I don't have 3 or 4. I saw a couple other moms here. I'm like, oh my God, you're heroes. It's amazing that you're all here pulling it together somehow. But I gave birth during the pandemic. My son is 10 months old. I gave birth, and the next day, the governor shut down the entire state. I felt like I was in The Walking Dead. It was literally like a zombie movie. It was so eerie, kind of giving birth at that moment. And my doula wasn't allowed to join me. So my husband kind of had to be my doula. And even for me, as somebody who was educated, when you're on the birthing table, you're in a very vulnerable position. And if you're coming in already with societal vulnerabilities, that's just going to get, unfortunately, that's just going to be compounded, right? So in maternal health, I'm kind of just saying this just so folks can get kind of the bigger idea. And I think Nurture New Jersey is looking into that. But the solutions when we think of solutions around maternal health, or what Moms Rising has done, we really do look at all that and did the awareness raising with our members. We have 1 million members in 50 states. We have about 10,000 members in New Jersey. So the first part wasn't, let's just get everybody activated around policy. As Debbie knows, there's so much of the fertilization of information, and to even let people know, hey, this is an issue, so that legislators know that this is an issue. Because 4 years ago, you did not hear legislators really talking about maternal health. Now when they talk about health, that's Black maternal health, that 3 to 4 times death rate statistic, worst in the developed world, in any developed country, that is on the forefront now. But that's because of the work of advocates and also people who are on today's chat today. They said this is an issue, and through that galvanizing collaboration, story collection, which is a lot of what Moms Rising does, is uplifting these stories. We worked in coalition with groups like ACOG, the American College of Obstetricians and Gynecologists, and Black Mamas Matter Alliance, a lot of other organizations, to successfully get national maternal legislation passed with the Preventing Maternal Death Act in 2018. Even in these hyper-partisan times, that passed through. It was bipartisan. The president signed it and it became law. But that's just the starting off point, right? So the federal policy is important. the state policies are very important, but there's also so much that needs to happen in the hospitals, that needs to happen with things like doula care access, supporting doulas, midwives. If home births are on the table, what does that look like? Is that something we can make more accessible? So I'm just giving a little preview of all that. But for Moms Rising, our work has been on the policy front, but our place is really about getting those stories and voices into those legislative spaces, into media, into the New York Times, and having things like tweet chats and Facebook Lives, and petitions that we deliver. And we made a storybook of birthing stories from each state that we hand deliver to members of Congress. Now with COVID, less so. But even during COVID with the CDC, their recommendations were all over the place. When I was giving birth, there were no recommendations. Nobody knew what was happening. And that's not necessarily a criticism of anybody. It's such a strange time for everything and everybody. But it was, especially if you're vulnerable, if you are a woman of color, your rates are going to go up during COVID. You're going to be at an even worse disparity during COVID. So we advocated with the CDC to ensure that their guidelines aligned with the World Health Organization's guidelines, so that our birthing people could be protected during a time of COVID.
Yeah. You said so many important things there, Nadia, but I think what struck me the most, and I saw Debbie nodding her head too, because I believe the two of us can relate to this. You said, 4 years ago, we heard so much less about this. When I lost my daughter, and when Debbie lost Autumn, crickets. I mean, I felt like I was by myself out there searching online on Instagram. Can I find someone else who's going through this? And that's honestly how I connected with so many moms, was sort of through social media and finding someone who was going through what I was going through, because it's a very isolating experience. Since then, through advocacy groups like 2 Degrees, like the Tears Foundation here in New Jersey, I mean, so many others, but the conversation around pregnancy and infant loss, and subsequently how that impacts mothers, because yes, it's pregnancy and infant loss, it's the baby, but it also profoundly affects every aspect of a mother's life. So I too feel that the conversation's just getting started on that front, but it has made, I will say, incredible progress through people being more open about it. And so I think that is really the common theme here. And we've seen the same thing really about postpartum health and mental health and all things related to maternal mental health too. So I just wanted to that really struck me that you said that, because I do feel, while we still have a long, long way to go in all of these aspects, there is momentum, as you just said, with what's happened just in the last 3 years. Even 2018, you said, was when that was signed into law. So that's all good news on that front.
Sorry,
I want
to I made a mistake.
Oh, 19, I'm sorry. Well, yeah, so even less time then, just in the last year.
Very recent, December 2019.
It is absolutely so amazing to me, because, I mean, I lost Autumn almost 9 years ago, and I got the bill passed in 2014, and I'd say in 2016 is when I started working on my federal bill, and the caucus on maternity care was just new on the scene in DC, and the idea that there was even going to be a caucus around maternity care, that they even cared about, like, that maternity was even part of the conversation. And to see it now, there's so many different conversations and meetings and topics with regards to maternal health. It's so exciting, and I feel like we are just getting started. It is like just the beginning of so many endless opportunities, I feel, and I'm so excited for us, and as a mother of a daughter, like, to see what the future holds for her as well.
Yeah, I just want to get to a couple comments from some of the mamas watching. Krista had this point. She said, breaking the stigma is a huge part of it. And she's so right. So thank you for your work and for sharing your stories. And Nicole was mentioning that, the stigma as well, because she says that she didn't realize she had postpartum depression until years after her son's traumatic birth, and he had heart surgery, and then she had postpartum cardiomyopathy when she had her son, and had heart failure due to that postpartum condition. So yeah, it is really just, she says she didn't even realize she was, so it's the education piece. It's the, you know, making moms aware and then not feeling a stigma, I think is just so important. One other thing, and Sherry, I'm glad you brought this up because this is something we heard in our poll, and I know that as moms, it's kind of talked about so much, and I would like to get your take on it, both of you, Debbie and Nadia. Sherry says, I had great care during pregnancy and delivery, but feel that postpartum care is lacking. See you in 6 weeks. Okay, that's it. And then, you know, for mom, it's like, you know, then we're on our way. What can you guys tell us about that piece of it and the conversation surrounding that in both of your organizations?
Well, with regards to what we're doing, you know, having been somebody who went home in a week, you know, the whole week post the birth of my daughter, I was in pain and kept calling the doctor on call and saying, I think there's something wrong. And he kept telling me that my uterus was contracting and to relax and take more Percocets and it would be fine. And until week to the day that I came home, my husband had to bring me to the ER and I was in septic shock. I you know, contracted this infection and the doctor the whole time was like, you're fine, you're fine. Of course, it was an on-call doctor, not mine. But the point is he just wasn't overly concerned. I think that, you know, what's really important is I think it's going to be a domino effect. The more that we're talking about how to, you know, we need the follow-ups with regards to the postpartum depression piece of it all. And as far as women feeling confident in talking about whatever issues they're having post-delivery, because you can't just carry a baby and then have the baby and then be like, see you later. It doesn't work that way. But I think that the more that we're having this conversation with regards to maternal health, I think that protocols and policies will start to change with regards to, I think, post-birth follow-ups and things of that nature.
Yeah, I think it's pretty unacceptable that in this country, it is see you in 6 weeks. That is not necessarily the norm in other countries. That's not the norm in a place like Japan or even England, where you have a midwife that comes and checks up on you. Apparently, one of my coworkers at Moms Rising said in Japan, they literally come to your house, like almost like bringing food. It's like, you know, they just do stuff for you. You know, this is where things like a doula can really be helpful. Because what a doula is, that, you know, they're not a medical professional, but they're really the advocate for the birthing person. And I know for my first birth, you know, I had a 3rd-degree tear. I luckily was healthy and I didn't have any life-threatening issues. But after the second birth, and I didn't have that kind of a tear, I now realize what an impact and how traumatic breastfeeding was for me, how physically painful. Even now I say, you know, I broken bones. Breastfeeding was actually one of the most physically painful experiences of my entire life. And I was completely unprepared for that, even with a mother who supported breastfeeding, because she breastfed like a champion. So she couldn't even understand why I was saying I was suffering or hurting. But having a doula there made me feel, frankly, less crazy, because I didn't know who to go to with, and I didn't even realize the impact emotionally my pain was having on my psychology and my emotional state as a new mother. So that's a case where luckily I didn't have postpartum depression. Luckily I didn't have, you know, I didn't have a near-death experience after birth. Unfortunately, and you can look up, I mean, I don't have the stats in front of me, but the stats of maternal deaths, they don't happen on the table. They happen after women go home. So especially things like skyrocketing blood pressure, pulmonary embolism. She talked about the heart, the cardiac conditions. And even with and that's how, you know, with expanding Medicaid, it's one solution for folks who are on Medicaid to be able to get that care after birth. It doesn't stop as soon as you give birth, but for everybody in general, that period is so crucial to have partner or your village, or, you know, if there's anybody helping to take care of you, being aware, because you're so focused on trying to recover and raise a baby that so many things like, oh, my legs are swelling. Okay, well, that just happens after birth. Oh, I'm short of breath. Well, you know, I just gave birth and I maybe I haven't been getting enough sleep. So, and then it's just too late by the time you get in.
Yeah.
And so that 6-week period is a crucial period, not just for physical health, mental and emotional health, things like doula care. There's also one solution that has been coming up and is actually in some federal legislation is home visits. follow-up home visit care for everybody giving birth. There's also the centering, there's a centering model of pregnancy. The JJ Way by midwife Jenny Joseph, who's actually from England. She brought some of these methods in Florida, and she's almost lost no patients because of the methodology. So what I'm saying is basically, we don't need to suffer like we have, and we don't need to lose moms who should be by their children, watching them thrive and grow. That should not be happening. It is preventable, but it's not being prevented yet.
But I think that's also the piece, is empowering moms to feel confident in themselves and expressing their concerns to their doctors. I think, whether you're pregnant or whether you are postpartum, there is this, neurotic stereotype, of mothers, that they're like a little bit like loony or hormonal or whatever it may be. And I think we tend to take a step back and, have some serious pause about, like, do I really want to say this? Do I want to put this out there? Will they believe me? Is it really a problem? And I mean, that's been an issue for women across the board for centuries. And so, but I think if we can begin to empower moms and women to feel confident in believing their gut instinct and knowing their own bodies when something isn't right, I think we will definitely be, moving in the right direction.
I totally agree. I think that that's such a huge piece of it. I want to talk about, something actually unrelated to birth, but encompassing in maternal health. Just briefly, both of you as moms, this time right now has been so uncertain and filled with pressure from every aspect for moms. I mean, we're seeing all over the place how many moms have left the workforce, and, just making impossible choices for their families in a variety of ways at the moment. So much pressure, right? Have either of you seen any discussions happening on a broader sense about, like, better workplace support for moms, things like, being, more flexible with the work from home arrangements, things like that? Like, what has COVID kind of added to the conversation? Maybe not on the medical side of things, but just on the societal front in the maternal health conversation.
Well, I will say one thing I'm also recently been working on is early childcare, right? Because we all know right now childcare was in crisis before this pandemic.
Right.
And what this pandemic did is just kind of torpedo this crisis into real. And I think all of us, I'm doing virtual learning with my kindergartner. And then the entire month of September, I thought I was actually literally losing my mind. I actually thought I was going to have a nervous breakdown. It was so difficult. And I know that across the board, so many parents and caretakers have lost their childcare. They just, either the center closed down or because of COVID concerns. So there's a lot happening. And I wanted to point to, Marissa, some of what you talked about in September through November 2020. So this past fall, the pandemic led to a 144% increase in child-related work absences compared with the same time frame the year before. And they found that the vast majority of people who have left the workforce, I think not even vast, like 99%, something like that, have been mothers, have been women.
Yeah.
So what this is, and do we kind of know that we kind of think that that's probably what happened, but it's really showing the stark, whose back all of this falls onto, even when it comes to virtual learning, even if you have a 2-parent household, and you have a supportive spouse, it is falling on mothers. Mothers are leaving the workforce. They don't want to leave the workforce. And so what is that doing to your economic situation at home? What is it going to be doing to the economic situation of our state, of our communities? We don't have those answers yet. It's not looking great. I will say a lot of the support for things like childcare does come on a federal level. And so things like, I think this last package, there was $10 billion worth of childcare relief. So childcare is in crisis. The government really does need to do its job to really put in that money to prop up the childcare system, because what's going to happen is, once hopefully all this is over, what's going to happen, right? We have to deal with the consequences of what happened. And if there's no childcare system, it's going to absolutely take the bottom out of the workforce, especially for women.
Yeah. Yeah, I mean, it's such an important conversation that I think we're all so in tune with, whether you're a working mom or stay-at-home mom or whatever your situation is at home. Um, all of us as moms see other moms struggling in some capacity related to this. So yeah, I think that there's just a lot more to come on that. I was just curious, what you've been hearing. I'm not surprised by that stat, Nadia. I mean, like you said, I mean, I think we all know it, but like you hear it and you're like, yep, I believe it. Yeah. And Nicole just said, sometimes going to work is just enough to pay childcare and daycare. There's no money left for bills. Yes. I mean, everyone is having to make choices right now. And, if your work has been impacted by the pandemic, that's part of the conversation too, is the economics behind it. Yeah, a lot there to, I think, unpack. And I think it's going to be years of us kind of figuring that all out. I want to move towards ways that moms can get involved before we start to wrap things up, because as moms, we hear some of what we've been talking about tonight, and, it speaks to us, and we want to help and we want to do something. And what can we do, as moms who maybe aren't as involved as the two of you, or, are just hearing some of these numbers and statistics for the first time, and want to do something to sort of help the situation. Where do we start?
Well, I know that as far as, 2 degrees is concerned, we are always, looking for people to share their stories with us. We do definitely use social media as a platform to spread the work that we're doing. And so if people want to reach out and write something for us and tell us about their story, we are always looking to hear what others have to say and what they've been through. We also, obviously when it's not COVID era and we are able to have fundraisers again, we're always looking for volunteers that can help us to put those together. And we are a not-for-profit, and we are trying to raise money to do research and to roll out education and trainings and anything that we can do to help hospitals and birthing facilities along. So sharing what we're doing, and if maybe there'll be someone that is interested in donating money to us, we can use it. There's no doubt about that. But we are definitely looking to create awareness, and we are looking to improve stillbirth outcomes. And if there is a way for people to share what we're doing, and maybe, at the very least, it could maybe even be put into someone's head that, stillbirth, they can hopefully save a life in some way or another by knowing what we do.
Nadia, how about you?
Moms Rising, as I mentioned, is a membership organization. It's not a paid membership organization. One thing I really love about how we work is we try to meet moms and parents where they're at, right? And in the most accessible way as possible. So if you go to momsrising.org, that you can sign up for our email list. It's really that easy to be a member if you want to sign to our email list. So if you're in New Jersey, you will get not only national alerts, you will get state alerts. You might get emails from me saying, or support this piece of legislation, or share your story about childbirth, share your story about about early child care access during the coronavirus. Share your vaccination story. What are your concerns about getting access to vaccinations, or what does that look like for you and your community? So we always do a lot of story collections. Those stories are used for advocacy purposes. They're used to give to our decision makers in Trenton and in Washington, D.C. They're also, stories are also something we uplift for media outlets. So the media outlets have that direct connection to parents and moms who are living through so many of these issues on a daily basis. So momsrising.org, check that out. If you have opinions and you'd like to write, we have a blog. So you can just go on and submit something to us to write on the blog, and we'll take a look at it. We are also on Twitter. So I know for some folks, their emails are completely a mess. It's so many emails coming through. So I understand the email list might not be for everybody, but we're also on Twitter. Moms Rising is super active on social media, on Facebook and Twitter. We have, if you're interested in maternal health, every last Monday of the month, 8 to 9 p.m., we have a hashtag maternal justice, one word chat. So you can just jump on Twitter, hashtag maternal justice, follow us on Twitter. You could retweet us, join the conversations. We have other tweet chats, hashtag wellness Wednesday. So you cover a variety of issues. And I'll just say that right now there's something called the Momnibus, which is a it's 11. It's a 9 to 11 bill packet that's in DC, and if that gets passed, that's going to be a revolutionary bill on maternal health. So if you're part of Moms Rising, you'll definitely hear about it. We'll send you alerts. We'd love to get your signatures in support of that. We'd love to get your stories, because signatures are great, stats are important, but stories illustrate everything. And really the only way to get anything passed is through stories. So that's how you can be involved. I'd love to see you be part of Moms Rising. I always love to see us have a bigger New Jersey presence, because I'm a very proud Jersey girl. So
I love that. Just a couple great comments I want to shout out. First of all, is it Sienna? Where did you go? I lost her. Oh, Sienna Grace just mentioned, you women are rock stars. Thank you for sharing your stories. Alice says, amazing spokeswoman for maternal health advocacy. So much appreciation for what you guys do. Krista wants to know, will there be a way to get in touch with you all after this event? So Krista, I hope you just caught that part of it, just the social media aspect of it. Stacy with 2 Degrees just dropped a note there for the 2 Degrees Foundation. But she's on it. Stacy's on it.
Thanks, Stacy.
But Nadia just talked about the Moms Rising piece also, Krista. So hopefully you caught that, momsrising.org, which I think is very important for people to check out. One thing I just wanted to say on the heels of that, Nadia, is you're so right in the story piece of it. You know, that as like a news anchor for 15 years of my life and reporter, I mean, telling people's stories and sharing people's stories it's still a passion of mine, which is why I love doing this with you all. But it's so important to be able to actually hear and feel what someone else's journey is truly like, in any aspect, right? So having that personal connection when you're sharing this with a group of lawmakers, for example, and saying, Jenny from, you know, Edison, New Jersey, here's her story. I mean, that I'm sure. And Debbie, hello. I mean, that's what you did with your Autumn Joy Act, is that, you know, that is your personal story is what led you to that. And the impact that that has on someone really cannot be overstated. So that, I think, for both of you, that is so important.
And I think both of you sharing, even you, Marissa, sharing your story, you know, your story is, I mean, it hits you in the gut as a mom, you know, whether you suffered a loss or not. If you have ever loved a child, that's going to hit you in the gut. And even if you say statistics about infant mortality, maternal mortality, that's sad, that's shocking. But when we hear your story, Marissa, or your story, Debbie, I mean, then we feel it. And I feel, and it's like, if you feel something, you don't forget it.
Right. I love that. It's so true. This was fantastic, ladies. I just want to give you both sort of a chance to give some parting words to the mamas watching. Just maybe a little words of encouragement if people are struggling in some aspect of maternal health. There are people out there like you fighting for it so hard, I know. So anything that both of you want to say to kind of wrap things up?
Well, first and foremost, thank you for having me here tonight, Marissa. I really, really appreciate it. And if I could say anything to anyone out there who is suffering or knows someone that is, let them know that they're not alone. You know, suffering through anything related to, you know, your own experience with pregnancy loss or pregnancy struggles or postpartum issues or the loss of a baby. I mean, any of it is awful, and it is can be completely traumatizing, and you feel very isolated by it. And I just need everyone to know that they're not alone. And you know, we're all here today trying to create a sense of community and to let them know that we are here. You know, myself, 2 Degrees, you, Marissa, you, Nadia, and everyone else. So many of the other amazing maternal health organizations that we do have in this state. And, you know, feel free to reach out to us. I also, Stacy is really so much more on it, but 2 Degrees does have a Facebook page. Feel free to reach out to us there or on Instagram or on Twitter. Our website is the2degrees.org. Feel free to look us up there and contact us. I'm always available to talk, and I'm always happy to share any sort of resources. So if I could help in any way with that regard, I'm there.
And similar to what Debbie said, you know, I'm here to say that I validate you. Whatever a mom feels, it's not wrong, and and trusting ourselves, trusting our gut. That I really can't I can't overestimate how important that is, to trust your gut and trust yourself. And I wanted to say, you know, moms, our voices we're powerful. We have power behind our voices. We are taking on so much, and even if we don't take it on purpose, it's put on us, such as a time like in COVID, right? I wanted to say that yes, you're not alone. I want to validate you with what you're feeling. What you're feeling is not wrong. That you actually are the expert of your own experience. You are correct about your own experience, and don't let anybody ever tell you that is not the case. There are resources out there. When I say that, I mean social media is imperfect, but it is still an avenue to get involved. So even Googling, like 10, 15 years ago, Google didn't work. At least now you can get some information and find out about our organization. So even if you forget, you just remember Moms Rising, you can Google Moms Rising. You can find us, you know, join us, blog for us. I'm Nadia, Nadia, at momsrising.org. That's my email. I couldn't figure out a way to put it in the chat. But if you would like to reach out to me, absolutely feel free to do that. And, you know, I just, again, yes, you're not alone, but we're also powerful together. Your voice is powerful. We're here for you, and know that there's resources out there, and there's a reason why our organizations were started. We didn't start it for ourselves. We're not doing this work just for ourselves. We're doing it for all of us. So we're in it together, even if it doesn't always feel that way. And please join us, find out about us, reach out to us.
I love that. And I love that you said that we're doing it for each other, really. I mean, that's what it's all about. And that I think in and of itself is so powerful to hear and to feel. Thank you both so much for joining us. And I want to mention too, you know, I'll be moderating the roundtable coming up in a few weeks. And for anyone watching who's curious, you know, what comes out of that, all that, I'm going to be writing a piece for NJ Mom just about what I learned from that. So keep an eye out for that on our site in the coming weeks, because I'm really looking forward to hearing what comes out of this discussion and keep this momentum going with this discussion, as both of you have been doing so incredibly. So thank you both so much for being here.
Can I add one last thing really quickly? Sorry, as it's so hard. Sometimes I get so focused on the task at hand. I also do just want to add that since COVID started, the 2 Degrees Foundation and Melanated Moms partnered together to create a virtual support group for all moms in New Jersey called Virtually There. And we share all of what Marissa and NJ Mom does. And we have people share, you know, tips and speakers and anything mom related and parenting related and anything New Jersey centric. So if you're ever interested in checking us out on Facebook and seeing what we're doing at Virtually There, come swing by and say hi. It's just about moms and just about helping.
And those are 2 good things that we can all be in agreement with. Anyone watching this tonight, helping moms is a good thing. So thank you ladies both so much. Really appreciate you joining us and taking the time tonight.
Thank you so much for having us.
All right, take care.
All right. Bye. Bye.
All right, guys. So many great comments and feedback on all of this, and I hope that you all got some, you know, new information out of where things stand with maternal health and the work that's been done, the work that still needs to be done, and how you guys can get involved in this. We really appreciate you taking the time to take our weekly poll. As I mentioned earlier, if you missed this at the start of the chat, I look at the answers each week to really get a sense of what you guys are thinking and feeling about the topic that we're going to be discussing each Tuesday night. And so much of what you said this week, I was like, yes, we need to dive into this. So thank you for sharing those answers. And if you have a topic or a guest that you think would be great for these Tuesday night NJ Mom nights in, please let us know. Drop us a message, drop us a line. We're always happy to hear from you and always happy to cover and talk about and feature things that you're interested in hearing about and need support with, because that's the whole reason we do this, is to kind of offer that chance to connect with one another and support one another through this time. So really appreciate you being here. Nicole, I'm so glad. It was wonderful. They're amazing. They do amazing work. And again, keep an eye out for an article on the site talking about what comes out of this discussion. I'm looking forward to hearing from the other organizations that Nadia and Deb mentioned, who are all really fighting to empower moms in every aspect here in New Jersey. So we will keep you guys posted on that work, as always. Thanks for supporting us tonight, and thanks for all of your great feedback and thoughtful questions. And we will see you back here next Tuesday night.